Hi, this is Andrea Kane, and I'm here with you for HSC 114 Medical Terminology, where we are studying the Language of Medicine 12th edition by Davy Ellen Chabner. And we are now on to Chapter 6, where we are looking at additional suffixes and digestive system terminology. So let's see what they have for us. Obviously, we're going to look at new suffixes and combining forms. We're also going to delve into some lab tests, clinical procedures, and abbreviations that are common to the digestive system. So let's talk about those suffixes. We have ectasis and ectasia, meaning dilation or widening. Ectasis, ectasia. Emesis, hepsia, phagia. And remember that G means eating or swallowing. Phagia is the eating or swallowing. If it's an S there, that's going to mean speech or speaking. Plasty is surgical repair. Remember when we talked about the P before consonant? That typically that P is silent. So this would be ptysis. Ptysis. And now we get into our RRH combinations. RRH, rage, ragia, raphi, rhea. So we have rage or ragia, meaning bursting forth of blood. Raphi means to suture. Rhea is flow, discharge. Then we have spasm, stasis, spasm, stasis, and stenosis. Tresia. Tresia is opening. Some suffixes are also used alone as separate terms. Example, emesis, meaning vomiting, or to cause to vomit. Lysis, to cut. Spasm, stasis, stenosis. If you say someone has stenosis of an artery, it means a narrowing of that artery. All right, quick quiz. Which term means difficulty in swallowing? Difficulty in swallowing. Now, aren't you glad I told you the difference between the S and the G? It should make this so much easier for you. All right, quick quiz 2. Which term means to control or stop bleeding? Control or stop bleeding. All right, moving on. Some combining forms and terminology. Bucco is cheek. Ceco, cecum, celio, abdomen. Celio is lip. Coli, gall or bile. Cholangio is bile duct or vessel. Cholecysto is gallbladder. And choledocho is common bile duct. So notice that cholangio just means bile duct, but choledocho means the common bile duct. All right, some more. Colo and colano both mean colon. Denti, tooth. Duodeno, duodenum. Entero, intestines. Esophago, esophagus. Gastro, stomach. Very familiar one there. Gingivo, gums. Glosso, tongue. Gluco and glyco mean sugar. Hepato, liver. Hernio, hernia. Ilio, ileum. Jejuno, jejunum. Labio is lip. Linguo, tongue. Lipo, fat. Litho, stone. Odonto, tooth. Oro, mouth. Palato or palate. Pancreato is pancreas. Procto, remember that's anus and rectum, both of those together, because recto is rectum, and there's a separate one also for anus. Remember we had that at the very beginning, ano. Pyloro is pyloric sphincter. Saladino, salivary gland. Spleno for spleen. Sciato means fat. Stomato is mouth. Quick quiz number 3. Which term means enlarged liver? Enlarged liver. Not inflamed, but enlarged. All right, moving on to lab tests and clinical procedures. Some of the ones you'll see that are commonly done include amylase and lipase tests, where they're looking at the levels of those enzymes in the blood. Liver function tests, also known as LFTs, they test for enzymes and bilirubin in blood. Stool cultures look for microorganisms in stool. Stool Guaiac tests or hemoccult tests, mostly known as hemoccult. But what they're doing is they're trying to detect blood in feces. Quick quiz number 4. Which of the following tests looks at the clear fluid that remains after blood has clotted? So it's looking for blood serum. And it's looking at the clear fluid. Well, we know it's not A or C because those have the word stool in them, and that's not what we're looking at. Hematocult is also stool. So it has to be liver function tests, where they're looking at that clear fluid that remains after blood is clotted. All right, moving on to clinical procedures. Lots and lots of radiology tests, including lower GI series, upper GI series, cholangiography, CT scans, ultrasound exams, looking at abdominal ultrasounds, endoscopic ultrasounds, MRIs, something called a HIDA scan. That's a hepatobiliary immunodiacetic acid scan. It's never read out like this. It's always HIDA scan. So if you're thinking HIDA scan, it's a nuclear medicine test looking at the liver. And obviously the bile. All right, so moving down to other procedures. There's gastric bypass or bariatric surgery. Gastrointestinal endoscopy is very common, where you're doing an endoscopy to look at that GI tract and see if there's something happening there. Laparoscopy, you're going in and examining the abdomen. Liver biopsy is just what it says. You're taking a piece of that liver tissue for examination. Nasogastric intubation is when you're putting a tube down through the nose into the stomach, so that you can put fluids down there, or remove fluids, as it may be. Paracentesis or abdominocentesis, that's where you're puncturing and you're removing fluid from the abdomen. Someone might have ascites due to cancer. You're removing that fluid from the abdomen. All right, which procedure is a surgical puncture to remove fluid from the abdomen? Ooh, we just talked about that. Hopefully you've got it. On to abbreviations. Most of these are just something for you to be familiar with. Not all of them are honestly used in the medical field. I mean, they're there and available, but unless you're a specialist in the specific area, most of these are not used. So I'm just going to leave them here for you to take a look at. And again, some more. GERD is a very common one. You'll see GI is very common. IBD, if you work for a GI doc, you might see that one, or you work with patients that have that, you could see that. MRI obviously is a very common one. NG tube, another very common one. NPO is one that you'll see a lot of, especially if you're a nurse. PEG tube and PEJ tube, those are percutaneous endoscopic tubes that are put in. And let's see, TPN, total parenteral nutrition, that's another common one. So on to suffixes. Ase means enzyme. Centesis is a puncture to remove fluid. So you may have like abdominal centesis, that type of thing. It can also be performed in the lungs if someone's got an issue with a fluid on their lungs. Chesia means elimination of waste. Ectasia is stretching, dilation, expansion. And ectasia and ectasis mean the same things. And you really have to learn the context of the word to know which one to use. Ectomy is removal, excision, resection. Emesis is vomiting. Emia is blood condition, and genesis is producing or forming. Graphy is the process of recording. Iasis is abnormal condition. Lysis is breakdown, separation, destruction, loosening. Megaly is enlargement. Orexia is appetite. Pathy is disease or emotion. Pepsi is digestion. Phagia is eating or swallowing. Prandial is meal. Plasty is surgical repair. Ptosis is droop, sag, prolapse, or fall. Ptysis is spitting. So notice that the difference between that O and that Y is between droop, sag, prolapse, fall versus spitting. Rage and ragia mean the same thing, bursting forth of blood, and you kind of have to know what the context is to know which one to use. Raphy, though, means suture. Rhea is flow or discharge. Scopy, visual examination. Spasm, that sudden contraction of muscles. Stasis, stop, control, or place. Stenosis, a tightening stricture or narrowing. Stomy is a new opening to form a mouth. Tomy is the process of cutting, and trasia is opening. And that is it for chapter 6. Thank you and have a great week.